The coronavirus pandemic has caused the nation and the world to recognize the critical role that pharmacists are playing in the fight against COVID-19, from working in labs developing vaccines and antiviral drugs, to providing statewide advocacy and education, to serving some of the sickest patients in critical care units. The CU Skaggs School of Pharmacy and Pharmaceutical Sciences is proud to introduce you to just a few of our pharmacists on the front lines.
The way things are working is there's now 4 teams dedicated just to COVID patients. So we're doing our best to come up with ways to get patients comfortable. The units, some of them are not designed to be ICUs. So the automated dispensing machines are not stocked with the drugs they needed to be, and we're not working the way they're supposed to be. So it took us a little while logistically to get things fixed. So there's a lot of behind the scenes stuff that we're doing as well that I don't think the teams see as much, but we're making sure that things are as efficient and smooth as possible in these sort of desperate, trying times. So obviously most of the focus is on COVID therapies, but there's a ton of other stuff. So these patients are requiring tremendous amounts of sedation that really I haven't seen before in my 20 years of practice, give or take some. So we're going through a lot of sedation. We're trying to come up with innovative techniques to see how these drugs work together. Sometimes trying to reduce the dose of one because it either has an adverse effect or we're getting short on that drug. And so we're coming up with different ways to try and treat these patients, keep them comfortable. I will say this. It's a crisis like that brings people together. I would say that I've never seen UCH have such a team atmosphere when it comes to taking care of patients, whether that be, the dietitian, the respiratory therapist, the pharmacist, the bedside nurse, and obviously the physicians all working together. The collaboration, the communication, it's really, takes, I guess a silver lining, right? It's optimized in a situation like this. I think the unpredictability of the virus, who's being affected, and we've had, I hate to say it, a 19-year-old all the way up to 86-year-old. I think the extent of their lung injury, these patients for the most part are just having profound lung injury, which is taking a while for it to resolve. So we're talking 2 weeks of high dose sedatives, high dose ventilators, that kind of stuff, which is not something you would see in a typical infection. You might see 2-3 days, but not 2 weeks. So they're sick for a while. It's affecting all comers. It doesn't matter what your background is, it's affecting someone. It's what we're trained for, first of all. So I think everyone sort of understands that from a family perspective. But I think everyone's a little anxious, but I haven't changed what I'm doing other than the fact that when I come back from the hospital, I'm stripping in the garage. So that's about it. But that's the only real, and then straight to the shower. So that's probably the only big change. Other than that, I think it's from me coming back from the hospital. I think there's probably just a general anxiety of the family when I'm going into the hospital, making sure making sure I'm safe. But this is what we're trained for. So it's we do the best we can. I think Skaggs does a fantastic job of training clinical pharmacists all across all disciplines, whether it be oncology, transplant, ambulatory care, or critical care. I think there's options for every student from that standpoint. Some of the students are interns, so they've had a chance to work and are actually quite excited to see this. We do have our residents, so first years and second year residents and a critical care fellow, and they're working through this. They're on service. And I keep saying to them, you'll never, ever see this again. You'll never see 60 sick patients on a ventilator from the same disease ever again. So this is a tremendous learning opportunity, but It's also a tremendous opportunity to make a difference